Here at Care UK, over the past year and a half, we've really worked towards improving our pathway. We've got to a point where now we can offer a hip or a knee replacement indeed as a day case arthroplasty. Now, what does that mean? It really essentially means what it says in the tin. You can come in on the same day and go home by tea time. Well, first of all, is it safe? And are there any good benefits for the patients? Well, really, it's all about the patients. First of all, it's absolutely safe because the enhanced recovery pathway, which we advocate, is very much centered toward the patients and the patient's needs. In terms of improvements of their quality of life, there's a lot of studies out there to suggest that if you get them up and about early, they do better in terms of managing their pain and, of course, in terms of decreasing their chance of developing DVT. So we all know DVT, it's all about staying still. Now, if you stay still and the muscles are not working, the clots can accumulate. If you get up out of bed, start walking, your muscles are acting as pumps, and it helps reduce the chance of developing clots in the back of your leg. Now you have to remember, day case arthroplasty is not all about getting a day pass, and if you're not safe to get out, you're still discharged. It's about safety of patients. It's about reaching the same targets that you might have done in day 2 or day 3. If you fail to meet those targets, there's no biggie. You'll be staying in and you'll carry on until you are safe to go home with the right support by your family and by the team here. Now, it's very important to realise that the support of the team here is 24/7. You have a direct contact number. If there's any concerns, ring the hospital. If you look at how we've progressed, hip replacement started essentially in the 60s. If you went into hospital, you'd be staying in for 8 weeks. Now that certainly has changed now to, over the past 10 years, hospital stays about 2 to 3 days. We've really made excellent strides to be where we are now. Often when patients know about day case arthroplasty, initially they're taken back and, it's not normal. Why are you putting me through this? And then you've got to spend time and, discuss the benefits, discuss how their journey will improve. The pain will be managed better. They are feeling better when they're going home, when they're back to their normal routine. And I think that's the key. As long as you get the patient on board, everything else follows. Day case arthroplasty has also a benefit wider reaching for the NHS. It frees up beds. If you think about the cost of bed, every night is £400. If a patient leaves earlier, that allows another patient to come in, and of course, long-term savings of up to £8 million. If you think about 10% of all joint arthroplasties can be discharged on the first day.